a historic health facility that existed during the First World War between 1914 and 1918 and the Second World War between 1939 and 1945, now in a semi-deserted, dilapidated state. The hospital existed under the British Empire, apartheid era, Transkei homeland, and now the Democratic South Africa. Despite its appalling state, the facility still provides essential healthcare services to the local community, mostly comprised of people from the impoverished backgrounds.
We don't have porters at all. We don't have people to work by the mortuary at all. There's no one in the mortuary working. Nurses, less than 50% of staff. Everything is short inside the hospital. The doctors are short. Water, there's no water inside the hospital.
Algae covered walls, trees sprouting from the roof, and leaky ceilings define this crumbling hospital where outdated beds and wheelchairs add to the air of neglect. A pollution facility here in a dehumanizing condition that poor people continue to endure to access healthcare services. It is very difficult. If you look around the nurses' home and doctors' residence, it's a shame. And these people work under very harsh conditions, but they continue to do their best. We have been asking government to do something, but still today there is nothing coming forward.
This hospital is not a regional one. It's classified as a provincial hospital, unlike others. We serve communities from as far as our Tambo district, that is your Sigis, your Flagstaffs and stuff, but there's no staff complement to actually render the service that they're supposed to be rendering as an institution.
For decades, rainy days have meant buckets scattered throughout the wards, with constant mopping a dismal routine. Every time I come in here, I have to make sure that the bedding is not wet. I move around these containers just to collect water that is coming through the ceiling. If it's raining like today, the offices are flooded and we have to mop up. We don't know how long must we continue working under this situation. We really don't know. The health department has committed to a multi-million rand construction project to revamp the hospital.
The hospital is functioning, although the water keeps coming in. The hospital is going to be refurbished and the contractor is expected to commence operations on the 25th of April 2025. The project is expected to cost between 150 million to 200 million.
We have been recently told, just like every other time, that construction will be beginning mid-March. We will be seeing some activity mid-April. So we are still lost on hope. We've got no hope because they've been making us hope for the past 5 years.
The multi-million rand road construction project leading to this decaying hospital was left incomplete. Electricity, water supply services is interrupted. I am Mbizana, SABC News, Greenville Hospital, Mbizana.